So, good morning, everyone. My name is Shazia Khan, and I'll be teaching you the Unit 5, which is Research in Health and Social Care. And just before we go into the session, I just want to tell you that we've got 3 learning outcomes and we've got an assignment discussion session. And on the screen that I've got there, which I've shared with you, is the assignment that brief that is available on Moodle for you. But we'll go through this in a lot more detail towards the end. Firstly, we've got to go through the learning outcomes, which we've got 3 learning outcomes, and we've got 4 sessions because we have an assignment discussion session as well. And the assignment brief and all the additional information for you is available on Moodle for you, okay? So Moodle is your main resource for using your VLE for all your sources and everything. And also, if there's any questions or anything, you can ask me throughout the session. I like an interactive kind of session. I don't know, I've taught some people before as well, Elizabeth maybe, and some of them, but I do like an interactive kind of session so that I understand that you're able to learn as well, so that you're learning as we're going along as well. Okay, has anyone got any questions or anything before we start the session?
None for now.
Questions.
Okay, so the learning outcome we're doing today is learning outcome 1, and it's all about the whole point of this unit is all about researching in health and social care, why it's so important, why we need research as well. So we're looking at learning outcome 1 first, and this is some of the indicative content to look at. So explaining the role of research in evidence-based learning. So we're looking at things like why research is important in health and social care. Does it play a big part in health and social care? Anyone? Do you think research plays a big part in health and social care?
I think so.
Yeah.
Why do you think, Udu, that it plays a big part in health and social care? You're right, but why do you think it does play a big part?
Because if we don't research, you can't really get enough of what you need
Yeah.
to go
So
about the social care, health
yeah.
and social care practice. Yeah.
What about things like
To me, I feel that the world is evolving every time, and
yeah.
there are new policies, new strategies on how to, resolve issues and all that. So we need
Yeah.
to keep on top of these things so it could help us in our
Yeah.
workspace. It could help us develop so many new things to work with.
Could it be things like, for example, if there's an illness, if there's a cure for cancer, could it be things like that, researching a cure for cancer, a cure for Alzheimer's or something?
Yeah, that's part of it.
Yeah.
Yeah.
So it could be this data that we use, all these statistics, all this research we do is to look at, try to make things better within health and social care settings. So we look at guidance, protocols, data methods, and we look at what this data does. So what we conclude from the data. Data is not always good, but sometimes it's good in certain areas like health and social care, because sometimes it comes up with things that can help and support individuals as well. So that's the indicative content. So key terminology, we look at research, why it's so important, and especially like we've discussed within health and social care, it's a crucial part of any sort of patient's outcomes, any outcomes we're going to get. So it might be things like trying to diagnose things earlier, making sure that they are trying to any sort of life-changing treatments, any sort of preventing any sort of people developing conditions. The whole point of it is to make any sort of improvement in someone's life and make sure they've got a better quality of life. So, things like making sure we're enhancing patient experience. We're making sure that there's things in place. If there's any sort of new medication that's come in place, try to implement that. And the big thing at the moment, you've probably all seen on TikTok, like we all use TikTok, is the Manjaro thing that's gone on to NHS. Which everyone thinks that they can get it on the HS, but there's conditions you need to meet before you can get that. And I think people are thinking that, oh, it's a new way of learning to lose weight. but it's not really, there are conditions in place, and the whole point of that drug was designed to improve people's lives with diabetes. Um, but it's a whole, new trend at the moment that we can get it on the NHS, which we had to pay before. So, trying to improve people's life. It's not a weight loss drug, as it is a weight loss drug, but it's not a weight loss drug for you to use for that instance. I think it's more to, try to help you with your diabetes. Uzu, did you want to say anything?
No, no, none for now. Yeah,
Yeah.
I'm listening.
Yeah, so there are areas why treatment is really research is really important. It discovers new improvements. It's got new changes, like Elizabeth said, any sort of changes to policies and procedures. Why do you think that's so important, Elizabeth? Any sort of changes? You mentioned it, but why do you think it's so important that we reflect on that?
Because, sometimes the way we do things, especially in the healthcare sector or
Yeah,
maybe the social care sector,
yeah,
the new rules that come along because of different maybe mistakes they've made along the
yes,
way, and
yes,
they need to correct those things and
yeah,
see better ways to support and help,
yeah,
so it doesn't put people's lives in danger. So
yeah.
they need to put these things in place.
Yeah, it could be things like you're saying, Elizabeth, maybe the use of, any sort of, equipment in a care home. People are not using it properly, and maybe the patients are getting hurt, or the staff members are getting hurt. So people, need to have training in place, and these research only helps you get a better quality of life.
Yeah.
Um, so we're looking at the next slide, which is what is the definition of research. So research in general is about the creation of new knowledge, existing knowledge, any sort of new concepts, any sort of new information, critical data. It might be any sort of understanding for the individual. It could be analysis of previous research that's been done to make sure that we've got then it leads to any sort of new creative research. It could be making sure that the argument is logical and there's reasoning behind it. So research is quite wide, dependent on how you define it in different concepts. But it is used a lot in all areas, not just health and social care. So we've got research skills. Why do you think research skills are so important? Why do you think having research skills is important? For example, if you're doing your assignment,
Is
you
it
need to research.
is it so you could get information
Yeah.
early
Yeah. Boma, what do you think when you're doing your assignment? Do you research?
Yeah,
Yeah. You have to research. Why do you have to research?
to get facts,
To
right?
get facts, to get answers, to solve problems. And when you gather information, you gather data, and you come to conclusions, don't you, Boma? So
Yeah.
when you come to these conclusions, it helps you identify why there's an important need to have research in place. Just hello to everyone else that's joined, Millie, Omika, Deborah. Hi to everyone, Adi as well. So, we were just talking about research, the importance of research within health and social care, why research is so important academically as well. As a student, research is so important because it helps you come to a conclusion, but also helps you solve a problem as well. For example, if you're looking at elements of a data, how you could come to interpreting that data to get a conclusion out of it. So it's really important is research in any organization. For me, for example, I teach law, business, health and social care. But for me, when I'm researching a case, it will help me come to a conclusion about a case that I'm dealing with. So maybe I'm looking at a previous case to help me come to a decision on maybe what the individual's going to get, in regards to sentencing, what. So I will be able to know because I'm looking at the previous case, which would be very similar to the case that I'm dealing with. So, it does help. in regards to how you implement researching into your day-to-day life as well. So we've got what is the definition of research? So the definition, characteristics, which we're going to look at more detail, qualitative research and quantitative research, and examples of that, and why there's a need to have quantitative and qualitative research, and why we need to use an approach like that to get good research and logical reasoning out of that. Has anyone got any questions? Okay, academic research. When we talk about academic research, what do we talk about in regards to that? What do you think that is? I mean, it's there on the slides, but from you, if I just ask you, what do you think academic research is?
Like research, gathering information about academical stuff.
Okay, so could you be doing academic research as a student?
Yeah.
Yes, and you could be doing it. This involves things like maybe investigation, maybe researching things, maybe analysis, doing a critical analysis, maybe looking at a question and trying to break that question up, making sure that, you have got, some theories in place, you're able to understand and expand. And it's having a look at broader academic resources as well. Looking at resources, teachers often, will have academic skills, and students will need these academic skills throughout your studies, throughout your life. It is really important to have academic skills in place. It could be learning strategies, how to time manage, how to be punctual, how to research certain things. I send my students away and say, research case law. That's a way of them researching and academic skills. So academic skills is a really important part of your studies for both students and teachers, and for if you have people in health and social care that are are considering becoming doctors or any other profession, they would have to research things about medication and things like that to try and enhance their ability. So we've got how our research, why is research conducted? Why do you think we research things? Why do you think we research?
To gain more knowledge.
Excellent. To gain more knowledge. So if, for example, Udu, if you want to make, let me just give you an example of chicken, yeah? Some sort of chicken.
Okay.
Would you research how to do it? There's that chicken called bang bang chicken. I've heard of that when I go to restaurants. Would you research that? How to make it?
I will if I don't have the knowledge of
Yes. So, if
making
you
it.
don't have the
Yeah.
knowledge, like me, I would go and research it. I would get a recipe. I would try to, implement that. So I've got knowledge and understanding of things. Otherwise, it's very difficult to put everything in and make a bang bang
Yeah.
chicken without knowing what goes into it. So
Yeah.
research, that's just a basic example for you to just take into. So if you're researching, it's expanding your knowledge, isn't it? You're having more knowledge. You're having more understanding of it. You're solving problems when you're researching things. Do you think you solve problems?
Yes.
How?
In order to have to create solution for what the topic is all about, and also
Yes.
for a future reference as well.
Yes. It's a
Also
way of getting
generate new ideas.
new ideas. Yeah, new
Yeah.
ideas. And if you're doing it in businesses, informing decisions and policies, developing new technology, that's a new one. Research is done to develop new technology. Maybe it may be the use of a software, it may be the use of some sort of testing or theories or anything. And it's really good. Research is conducted, is valuable for you as an individual because it improves your personal and professional development. You trying to find out things, it may be for your own personal gain as well. You might be wanting to solve certain things, or you might want to, like we talked about, Udo, the recipe, that's for your personal gain, isn't it? You wanted to try and, research that to try and make that recipe. So, research is fundamental process that is used for progress, innovation, and, having a deeper understanding of the world around us. It doesn't necessarily mean we've got to do it for an academic, area. We can do it for our personal gain. I do it all the time. I always check resources to do recipes. I like baking and it's new ideas for me. So I'll be researching what I can put in it if it tastes nice. It's all research, isn't it? And this makes you better. I did try to make that Dubai chocolate and I did really well with it. So yeah, I kind of researched something and put my twist into it and put nuts in it and it came out beautiful. So yeah, these kind of things help you implement your own new ideas, but also, research helps. Does anyone know within health and social care why research is conducted? That's from a business perspective on the slides, but what about health and social care? Why do you think research is conducted from a health and social care perspective?
To be sure about like whatever you're doing,
Okay.
to taking care of patients because it's very critical.
Yeah. But is it just
I think it's more like a more structured way of looking into things, like investigating,
okay, investigating what kind of things?
like risks, care plans, assessments,
Yeah.
just based on maybe the patient's how would I say presentation, maybe
Yeah.
due
Could
to
it
maybe
be
their trauma or whatever.
Yeah,
So
could it be medication and things as well?
exactly,
Yeah.
medication as well.
Yeah. Um, you know, Omiki, what do you think? Or Elizabeth? No, sorry, Millie. We've got Millie on as well. Anyone?
I think research also help in finding a cure to a particular
Yes.
disease or
Yeah.
sicknesses. Yeah.
Finding
Sorry, and
cures.
also to improve the life of the people we are rendering service to.
Excellent. Yeah, to improve their life, to try to make sure there's something in place for them, to
Yeah.
try and help them. There's
Yeah.
not always an answer for everything, even when research is done, but you can try, can't you? So research methods, we've got different methods of research. We have quantitative, qualitative, which we're going to go through in a bit. Mixed methods, we'll go through them in a little bit. So you've got a bit of an idea of what observations, it could be interviews, which we'll go through, surveys and things like that, which help you to get to where you want when you're doing research. So research methods. So like I said, there's two types of research methods that are more used often, which is qualitative research and quantitative research. So the one we're going to go through both, so qualitative research is a variety of approaches, and some common approaches can be things like, the use of one-to-one interviews, focus groups. Why do you think focus groups are so important? What do you think?
I think to share ideas.
Yeah, share ideas. And it also, does everyone have the same perspective? Do we all think the same?
No.
No.
So why
Well,
do you
I
think
think
focus groups are good then?
I think sometimes it's to share feedback
Yeah.
on maybe certain things that have been happening, what they want to change, or
Yeah.
how to help them serve
And
them better.
everyone has different views, don't they? Not
Yes.
everyone's views are the same. Your view might be, say, different to my view. But, we come up with ideas, but we cascade information. We help each other. That's why focus groups are good for elements of that. We have ethnographic studies, and these are involves things like people in a social setting who have different values, behaviors, and there may be observations, interviews to gather any sort of data, text analysis as well. We've got elements of case studies, having case studies in place, trying to identify any sort of elements of any sort of case studies, referring to case studies. Why are case studies so important? Why do you think case studies are so important? Could we refer to that case then? If we have a case study in place and someone's got, just example, dementia, could we use that as an example to see how that worked?
I think the important it like showed the application of the real world and got like an in-depth learning.
Yeah. So you could, the key principles of having this data is to make sure that it's there for you to identify any sort of data that comes in place. And it's really good because having qualitative data is all about using different techniques. So it could be using different approaches, like we said, case studies, focus groups, and see which one works. Not all the types of data will work. You may have focus groups that work better, asking questions, generating discussions. You may have interviews that are asking people questions in like a one-to-one conversation, collecting forms of texts, audios. It may work for some, but it may not work for others as well. You're there. When it comes to quality data, it needs to be prepared and organizing your data. So these are different types of elements of that. And then we've got quantitative data, and that deals with numbers and measurable forms as well. And it's numerical, and it's there to understand and investigate any sort of analysis. And it involves collecting data, which is quantifiable data. So it could be things like data through surveys. Why do you think surveys are good? Why do you think using survey questionnaires and things, why do you think they're good?
To give references to
give references. But are we, when we do some sort of survey, what are we trying to collect?
Information.
Information. So that information is gonna, it may be from one person, Udu, but it may be from 1,000 people. So how do you think that information is going to help us? Do you think we'll identify that data from that big sample?
I think so.
Yeah, that data will help us come up with some sort of resolution, or even a question. If it's an answer, we come up with that. We've got descriptive data research, which looks at describing the characteristics of the population or phenomena. And then we've got correlation data, which investigates and examines the relationship between variables, but not necessarily the cause and the effect of that. Why do you think having this data, let me just see, I've got some questions in chat. Providing solutions, excellent. Zoom user to have a variety of samples, yes, excellent. Why do you think we need this kind of data? We have the numerical side of data. Why do you think there's a need for it? Why do you think we survey people? Why do you think we have, statistics in place?
To know the actual number, a figure.
Yes, we can get an actual figure. We have this quantitative data is an effective method for collecting quantitative data, and which is at high rate of completion. So we are here, and it's really accurate as well sometimes, because we are researching so many people, and it's valid, and it can lead to, and they're looking at elements of sales and business, but it can lead to guidance and support for us, to have a variety of samples. We've got someone's to provide reasonable solution about a subject matter. Excellent. Yeah, someone's put in the chat to provide a reasonable solution about a subject matter, which is really good, because sometimes we do get to a solution, but sometimes we may not. But research is very, very important in any area. Quantitative data, and like I've said, it's valid. it's accurate, it's free from any errors or anything, and it's reliable and timely, and people can complete it to support any sort of business decisions, and it's collected in a time frame as well. So people, you know, the different methods that are used are maybe because it's make sure that the data is valid, accurate, reliable, timely, and complete as well. So the next slide is looking at elements of the 8 tips that we've got in place of accurate researching. And let me just try and increase the size of this. So you look at 8 tips for conducting research. Firstly, you need to have identified the main trends and issues, opportunities and problem you observe. So write a description about each one. Secondly, keep track on how often each of the main findings appear. Make a list of your findings from most common to least common. Fourth, evaluate the list of your strengths, weaknesses, so your SWOT analysis. Prepare conclusions and recommendations about your study and act on your strategies. And then 7, look for any gaps and then review everything. Make sure you're reviewing. Conducting, you know, this kind of accurate research is so crucial for identifying any sort of research questions and trying to improve the accuracy of your research. So it's really important to define everything at the start. Make sure you know what you are, how often each of your main findings are. Be aware of any sort of document research. Make sure you are researching properly and making sure that you are always conducting and keeping on top of the research. Why is it so important? Number 8, reviewing your results and conducting and looking for making sure you're on top of everything and that you are developing these skills. Why is it so important to keep researching and keep reviewing? Do things change?
Yeah.
Yes. So if things change, does that mean our research will change as well, Boma?
Yes.
Yes. Why? Give me a little bit of an example. You are right, 100%, but why do you think it will change if there's gaps or if there's new information that's come about? Why do you think our research will change?
Because if there's new information, new data, that means we need to upgrade our research.
Yeah. Do you think there may be changes that we need to make?
Yeah.
Yes. If there's any sort of new data, any sort of new information, we need to keep on top of that. And an example that I could give you would be, again, the big thing about the Manjaro being available on the NHS. You know, that why do you think they've put conditions in place? Requirements. You can't just get that Udu on the NHS. You can't just get the Manjaro injection on the NHS. Why do you think they've put conditions in place?
So I think to curb excess, how will I put it?
No, if there were no conditions in place, would everybody
Okay.
go and get it?
So that people can follow the
think so.
rules and regulations.
Yes, but if there were no conditions in place, then everybody Udu would want to get it, wouldn't they?
Yes,
It's
I
even
think so,
if they're
yeah.
so slim, they'd all want to go get it. But you know, if there's conditions in place, like they've got 4 conditions that you must have a heart condition. I can't remember them all 4, but you know, you must have them conditions for you to get that and you to qualify. So for them to put that into place is because they've done research on it. They've, you know, identified trends around it. Otherwise, everyone will want it.
I think so, and I think why they put the NHS put that in place, so because it might not be good for everyone.
Yes. Do you think?
Medically, maybe for those that have diabetes, that have
Yes.
heart disease and all
Yes.
sorts. Yeah.
Yeah. It's mainly for people that have the conditions that they want to try to improve. It's
Yeah.
not just for a weight loss thing. It is try to improve the people that have the condition. So they've researched everything. They've done a lot of research over years, and they've looked at it from a perspective of people wanting to do it just to lose weight. and they've put conditions in place. Maybe they've done a good thing, maybe they've done a bad thing, I don't know, but I'm just saying conditions in place will prevent them, people abusing it, really, you know, and the people that genuinely need it. So research is used for everything. That's why it's so important and needed in place for that. So what is research in health and social care? So health and social care involves things like healthcare practices, we have policies, social care, and the whole point of research is to improve the outcomes and well-being for individuals and the community. So it's a wide range of clinical studies, and they do clinical trials, don't they? Doopy, did you want to say something?
Okay.
Did you want to say something, Doopy?
No, please.
Yeah. Okay, so to have, did you want to say something? Sorry, I can't hear properly.
No, please.
Okay.
Yeah.
So to have research, health and social care research within the health profession is the whole point of trying to improve the quality of life. And why do you think they do clinical trials?
11.
Why do you think they do clinical trials? Anyone? Boomy? Elizabeth? Deborah? Miki? Uzu? Why do you think they do clinical trials? Why do you think they have to trial the product? If
I
it's some
think
medication.
Actual
safe
the actual medication that work for
of the
each
medication.
Sorry, what's that? One of you at a time.
Oh, sorry, I said it's more like to evaluate the safety
Yes.
of that particular medication.
But is it just the safety, or is it just
No, the safety and the effectiveness as well.
yeah, effectiveness? Because if it's not working, there's no point having it, is there?
Yeah.
Udo, did you want to say anything?
I said is to get the right medication for a particular disease.
Yes. Yeah, so you know, and we've got someone that's put in to find reasonable solution, to find a sustainable solution, yeah, to make sure that anything that's happening there, you know, that we're improving the healthcare outcomes. There's, you know, if we find trials in place that are going to help people, they will use this trial, they will foster any sort of innovation, develop any sort of evidence-based practices, and make sure that, you know, they are doing the research, but ensuring that patients and the public are involved in this as well, not just doing clinical research because, you know, trying to say this medication is, you know, good. They need to test it. They need to test the effectiveness of any sort of new treatments or intervention in a controlled kind of setting. Okay, so the next slide is what is health research, and like we mentioned earlier, it's there to diagnose any sort of medication or interventions that are in place, and you know, the whole point is to find answers for questions. You know, they want to find the best option for individuals and make sure that they have provided a life-changing treatment, prevent people from developing any sort of conditions, you know, making sure that, you know, people are, you know, able to, you know, ensure a better quality of life. And they use, you know, they have people for research, you know, people can take part in research. It may be that, you know, they want to look for someone who's got diabetes, and then they want to do some research on that person. So it's like a study to see how that person can take part in the research. How will that help them if we use someone who already has the condition? How would it help them? If they have to take part in a health research, and you know, they have diabetes and the health research is about diabetes, will that help the research?
Yes, it will help the patient to know more about his or her condition.
Yes.
And plan. Yes, and
it's using a case study, isn't it? An example of a person who has the condition.
Come again.
It's using a person who has the condition already.
Okay, yeah.
So, you know, it's the whole point of it is trying to improve your quality of life, trying to make sure they've got answers for questions that people are asking. You know, all this research is about, you know, intervention, making sure that, you know, you have outcomes in place. You know, if someone's going to ask you a question, you're able to answer it. And the whole point of having this research culture is to develop the research and make sure you, if there's any future research, try to improve it. You know, and again, like it says, the end one, it's answers for healthcare professionals. You know, they may know a lot, but they still, you know, need to know more. And if there's new resolutions for it, they will implement that. So what is an example of research in health and social care? And it could be anything. It could be you know, clinical trials for a new drug for Alzheimer's. You know, it could be the comparing of a drug for heart disease, which works better. The example they've got is for breast cancer. You know, it could be a drug or a placebo, you know, and it could be the effectiveness of the drug. So doing the clinical trial research on a new medical is tested on a group of people. You know, they have places in place where they pay people to test the drug. It could be a new Alzheimer's drug where it's looking at affecting the memory and, you know, the cognitive function of that individual. It could be a new drug to help you manage Alzheimer's. It could be things like, you know, like it said, breast cancer, any cure for that. It could be things like any issues around, you know, again, looking back at arthritis. It may be a new medication they've introduced, a new device, medical device that they can use, or any sort of new treatment. You know, the whole point of research in health and social care is trying to improve the person's life, but trying to make it better as well. Some people may think that, you know, certain drugs don't help them, but there may be new drugs that come into place to try to not get rid of the problem, because you can't fully get rid of a problem. It may be, you know, trying to implement a new drug. It may be trying to implement new antidepressants, you know, that will help the individual understand more things. So this research leads to important advances in medicine, within the healthcare profession. You know, having this kind of research is really important. I mean, some of you haven't spoken or anything, but when we talk about research in healthcare profession, does it always work? Do you think the research always works, as in the medication they produce? Do you think?
No, not all the time.
Why? Why
Because
do you think?
sometimes it's like a trial.
Yeah.
So it's just like you giving, just like making a research on particular stuff. So it's
Yes.
like 50-50. It's either it works or
Yes.
it might not work. And if it works, fine. And if
Yeah.
it doesn't work, you make more research on it, or
Yes.
you find a way out or a
Yeah.
solution.
It's a study, isn't it? It's a study, and
Yes.
it's trying to, you know, make it better for everyone, but it doesn't always work. Okay. Example we could look at, which is coming up quite a lot, is the COVID-19. You know, the implementation of the injections and stuff, and they have had, you know, impacts on people's lives now, having the injections. So, you know, at that time there was a need for it, and there wasn't time to do that much research. But the research around it now is that, you know, there's a lot of people that have implemented that have got illnesses after having the injections, and you know, after having COVID as well. So you know, the research at that time, because it was a medical emergency at that time, it was quite difficult to do any sort of research. And you know, people that have implemented and got long COVID have issues around, you know, breathing, around fatigue, around forgetting things, you know, brain fog and things like that. So, you know, there are lots of research out there to say that sometimes, you know, in a disaster time, it's something that's, you know, people are not obviously not getting back to normality. They're still trying to recover after having COVID, because there were no time to do trials at that time. So, you know, sometimes it works, sometimes it doesn't, but it is needed within health and social care. How research contributes to our NHS. So here is something that you can watch in your own time, and it looks at how research plays a big part within NHS. So that's that slide as well. Why do you think when we talk about research, why do you think it plays a big part within the NHS? Why do you think it plays a big part? Does it improve the patient care? Could it improve the patient? Yes, it could improve patient care. It could
and to
provide.
update the documents as well.
Yes.
Yes.
What else? What else, Addy? What else could it do? Anyone?
To
It will
improve
reduce
life.
costs.
Okay.
It will reduce costs of treatment.
Yeah.
Because if some sicknesses can be avoided,
Yes.
or they can be treated early.
Yeah.
Yeah.
It could
create more solutions in case
creates more solutions. Yeah.
Yes.
Is it just for patients, or could it be new? It could be new things for staff as well.
Yes.
Yeah, it could be for staff.
Yeah. So the whole point of it is to drive improvements in patient care outcomes, but also boosting staff morale as well and retention. You know, clinical trials, making sure that, you know, you're discovering if there's any sort of new treatments that you've discovered, improving existing treatments. And, you know, a good example is the development of penicillin. Things like CT scans, MRI scans are all revolutionized examples of healthcare that were researched and used, and they work, don't they? Strengthening, like, for your primary care, so making sure everything is efficient. And the whole point of it is trying to reduce mortality rates and make sure you are, you know, providing this patient satisfaction all the way through. And, you know, generating this value, economic value as well within the UK economy. And the whole point of research can be to identify any sort of risk factors and develop strategies for preventing any sort of illnesses. Research is not standalone in the NHS. It's an integral part of the NHS to make sure that healthcare is delivered and improved, and it's ultimately to, you know, better the outcome of the population. You know, the whole point of having healthcare within the NHS is promoting this healthier lifestyle, supporting people, making sure you're preventing any sort of illnesses, diagnosing things quite early on as well, because sometimes people go in and they've been told they've got, example, stage 4 cancer right towards the end. With all this research and everything, it makes it, you know, people know it can reduce the risk of any factors of disease developing or any sort of illnesses as well. So you can have a look at that in your own time. So we've actually finished the session now. Has anyone got any questions? Anyone got any questions?
No, not at all from me.
None. Okay. So we've looked at understanding the role of research today and why it's so important within health and social care profession. We've looked at different types of research, quantitative, qualitative, and we've looked at examples of that and why research is so important within health and social care and why there's a need to have research. You know, research plays a big role within health and social care, and we looked at the element of quantitative, qualitative types of research and why there's a need to have that. We've also looked at examples of that as well, things like, you know, focus groups, one-to-one interviews, and why there's a need to have that, and clinical trials and things. So these are some of the references that we've used for today's session, which looks at elements of research in health and social care, which you can right click and go onto them to have a look at them as well in your own time. In the chat, has anyone got any no questions? Thank you. So that's the research, and the plenary go on to Moodle for all your resources, okay? Further reading, any sort of additional reading, they've put on a link there to the value, importance and oversight of health and research, which you can look at in your own time, and any sort of evidence-based practice you can look at in your own time that you can look at. Any sort of queries or questions or anything you want to ask, please email learnerwork@ukvarsity.co.uk. Has anyone got any questions before we finish the session off today? Because we have another session tomorrow, which is learning outcome 2.
Hi, sorry.
Yeah.
Are there like any ways you guys could upload the recording on?
Yeah. This recording will be uploaded on Monday because, you know, it's the weekend. So what we'll do is I've done learning outcome 1 today. The next learning outcome is tomorrow, learning outcome 2, and this will all be uploaded. Everything on every unit is uploaded onto Moodle, so you can listen to in your own time.
Okay, thank you.
Okay, Boma. So, you know, just keep on top of Moodle. It's really good. It's a good virtual learning environment and it helps you get all your resources. If you're struggling with anything, email learnerwork@ukvarsity.co.uk.
Sorry,
So,
excuse me.
yeah,
About the recording, where can we find it, please?
on Moodle. It'll be under the
Okay.
unit that you're
Okay.
doing. Okay, so all your recordings should be under all the units that you are doing. For each unit, you will have the recording. You will have the recording for all the learning outcomes and then the assignment discussion. So you could listen to that learning. So, you know, you'll have it's good to attend the sessions as well because, you know, it's good to collaborate and work together and get ideas from each other. But also it is recording if you can't attend the sessions and you can listen to them in your own time. But also what will happen is they will all be put onto Moodle on Monday because it's the weekend. But we've got learning outcome 2 tomorrow, so that will be recorded as well. Okay? Any questions before we finish the session?
Please, our assignment, when is the deadline?
Is 2 weeks after the assignment discussion session. So your assignment discussion session is next week on Sunday and then 2 weeks after that. Now, if you need extra time, you need to email learnerwork@ukvarsity.co.uk to ask them for extra time, okay?
Okay. The assignment, is it for the unit 1? The first assignment we are submitting?
No,
It's
this is for this unit. The assignment, I'm only doing the assignment discussion for this unit.
Okay.
Which is the research one. So everything in your assignment that I'm doing from today will be included in your assignment.
Okay.
Okay, so we're doing learning outcome 1, 2, 3, and then the assignment discussion. So we do all the learning outcomes. Everything in them learning outcomes will help you do the assignment.
Okay.
Any other questions? No? If you remember anything, Udu, ask me tomorrow as well, okay?
Okay, I will. Okay, thank you.
Anyone else? Boma, anyone?
No.
Thank you.
Thank
you,
you for your
everyone. It was lovely
time.
teaching
Okay.
you, and I will see you all tomorrow at 11 o'clock.
All right. Thank you.
Have a
Bye.
nice day.
Thank you,
Bye.
guys.
Thank you.
Bye.
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 Bye.